Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we are honored to welcome a remarkable guest, Dr. Lorre Laws. She's a professor at the University of Arizona in integrative nursing, and she's also the author of Nursing Our Healer's Heart. Welcome, Dr. Lorre. How are you?
Oh, I am fabulous, and I am so excited to be with you today and talk about all things home health care because that was what I did my dissertation in, was home health care. So I am just super excited to be here and looking forward to our conversation today.
We're looking forward to it also. And if it's okay, I'm going to call you Dr. Lorre for the rest of the show. I want to kind of start off, though, with really what drove you to discover the silent epidemic that's affecting nurses everywhere. I have a lot of friends personally that are nurses, and, I know burnout's a major thing, especially, what we went through with the pandemic, but what really drove you to discover the silent epidemic that's affecting nurses?
Yeah, it's a silent epidemic that's affecting nurses and really all healthcare professionals. I happen to be a nurse scholar, so of course that's where I started my research. But what I was noticing is in my role as an integrative nurse coach, working with nurses who were experiencing burnout, is that I started discovering that they were refractory. They weren't responding to the normal burnout self-care sort of approaches. And that got me curious, as I've been I started in the 1970s as a certified nursing assistant. And so this same burnout conversation has been having, and we haven't made any real progress in half of a century. So as a scientist, we love research questions, right? And so it's like, well, why is this happening? Why is it that for half of a century, we haven't really made progress on burnout? And so as I did 5 years of research across 4 different disciplines, so I went outside of healthcare, also seeking for solutions in kind of more of the neurophysiology and relational neuroscience. And so I kind of went on this mission and deep dove into the evidence base. And what I found is that in a good number of cases, the majority of cases even, is that we have unintegrated trauma. And it is, the symptoms overlap so substantially that it is often misattributed to burnout when there's usually an underlying trauma element. And so it's really getting to that underlying trauma element and then when we started addressing it through that lens, then the nurses started to improve. And it's like, wow, I think we have something that's so much more than just burnout. And then I started looking in different countries. I looked in Australia, I looked in Canada, I looked in Europe, and continued to look in the US. And even though the healthcare systems were designed differently and functioned differently, there was this common denominator of and that's where the silent epidemic came. It's like, we have something far more serious that is underpinning the burnout narrative, which in and of itself hasn't been updated in 50 years either.
Wow. So I just want to kind of dig on that a little bit more. So you're saying and please correct me if I'm wrong, I'm looking just so that I can kind of, formulate it in my head. If you ran across a nurse that was, quote unquote, suffering from, burnout, it wasn't necessarily because of her job as a nurse, but maybe that contributed to it. But the root cause was some sort of trauma or neglect or abuse that he or she may have experienced in the years past. And then it contributed to her being more susceptible, or he being more susceptible to having burnout.
Well, That sort of. So when we look at occupational related trauma,
Mhm.
you know, those of us who are healthcare providers, and that would include our home health professionals, right? We go out and we have a high degree of trauma exposure that is occupational related.
Sure.
Now, part of that we get training for, right? We get training for the secondary or the vicarious trauma. We as healers and health professionals, we suffer to some degree along with those in our care, and we've received some training in how to navigate that. We also receive some training as regarding what to do if we have a national disaster, a flood or a major earthquake. So as health professionals, we all get some sort of training and preparation for how to manage that type of trauma exposure. But what is really happening is that we have a lot of occupational related system and or organizational related, the short staffing, the violence, the other factors. So that's like on the occupational side of things, and that is what's um, tilting the scales. But to your point, to your very good point, is that each of us, so if you start looking at the research, which of course is, what I do for a living, right? And so if you start looking at the research, and I went to the American Association of College of Nursing, and they put out the guidelines for every nursing program in the United States. All right. Every single nursing program, you are with the AACN as the acronym. And so I went and looked at what is their position statement? Like how are they saying that we as nurses and health professionals should be approaching this trauma phenomenon? Because as you rightfully stated, so many people have experienced some sort of traumatic event in their it's part of the human experience, quite frankly. And so how does that affect what we're seeing in the burnout, which is oftentimes trauma? And so I went to the AACN, I started deep diving, and their position statement is that we as healthcare professionals, we should assume that every person on this planet has had some sort of trauma, right? That they have experienced that. Now, it's not our job to uncover it.
Sure.
It's not our job to relive it. We don't need to know what it is. We just need to take that approach. And so that got me really thinking, like, okay, but aren't healthcare professionals and nurses, aren't we a subset of the everyone?
Right.
And indeed we are.
Sure.
And so that sort of started me on this whole rabbit hole, if you will, of really looking at, so how does trauma work? How does what maybe experienced in my life and you've experienced in yours, and everyone in our audience today has experienced something. How does that work? What happens in the body, and how does that translate to how it is expressed or experienced in the workplace? And so that was a 5-year question.
How long was your research from start to finish?
From start to finish, it was 5 years, and I self-funded it. And I self-funded it because I wanted to make sure, and there's bias everywhere in the world, so I'm
Absolutely.
not throwing shade anywhere. But there's a lot of in my profession as a scientist, there's a lot of bias that can creep in terms of funding mechanisms and publication and so on and so forth. And it takes 17 years to bring evidence into full adoption and practice. Well, the world is hemorrhaging nurses.
Right. Sure.
By the end of the decade, we're going to have just half the number that we need. So it's like, all right, I'm going to self-fund this. I'm going to write a book as though you and I are chatting over a cup of tea, like we are right now. Only it's coffee at this time of day for me. And bring it into the living rooms of the nurses, the home health professionals, the allied health professionals, as though they were in private session with me,
Mm.
and really exploring what is the burnout, what are the symptoms, and bringing out this 4-step process that we can use to sort of examine, is it burnout or is it something more? Is this how, and we can unpack how it might be helpful to unpack how our body responds to trauma, and how that works for all of us. And then how does that show up when we also then, so we as individuals, we all have experienced trauma, and then we go to work. I call it the trauma trifecta, actually. So here's, like, at the bottom of this trifecta, here is the individual traumas we've all experienced as part of being living on this planet at this time, right? And then the next layer in this trifecta is what we call the unavoidable trauma exposure. And these are the things that I talked about that come with the profession, right? The secondary or vicarious trauma and trauma from disasters. We get training for that. So as healthcare professionals, we have the individual traumas that every human's been exposed to. We have the unavoidable trauma exposure that comes with the job. And what's causing everyone to kind of mass exit is we have a whole lot of avoidable occupational trauma exposure that isn't being addressed, isn't being recognized, which is part of the reason why I'm doing what I'm doing. It's like we need to move past the burnout narrative because there's something more happening. And if we start to take a trauma-informed approach to what we are now calling burnout, then, as with the nurses in my practice, that could generalize into improved outcomes for all in our care, including the safety and professional well-being of the healthcare professional.
Right. That's fascinating. Why is nurse-specific traumatization frequently misdiagnosed as burnout?
Well, that was like, it's as though you were in my research brain right now, Lance, because that was one of the questions that I had. So while I was doing the research, and as a scholar and scientist, we have certain rules we have to play by. We have to the philosophical underpinnings and the theoretical underpinnings and all of this kind of yada 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 stuff that we're charged to listen with and pay attention to and make sure that we're bringing the best evidence out to the general public. And so looking at a middle range theory by Dr. Karen Foley, I just want to give attribution to that because she is the one that brought out the theoretical framework for nurse-specific traumatization. And I got very curious. About, well, I wonder what the symptoms of burnout are, and I wonder what the symptoms of trauma are, and how they overlap or how they differ from one another. I got very curious. And so in scientific realms, we call that, let's do a symptom cluster analysis, which is, a deep dive into the evidence base, one of my favorite places to hang out. And I started really looking and examining across physical, cognitive, emotional, relational, and spiritual or existential domains. And behavioral. And so I made a bucket for each of those, and I'm like, let us deep dive and find out what the symptoms are for each. And what I found, and I was using SAMHSA criteria, what I found was a stark overlap. Like, I didn't quantify it, but it was substantial enough that I wrote a book. So that's how substantial the symptoms are. And so you really then start looking at, what is the definition of burnout anyway? Like, I got curious about that. So I went to the World Health Organization, and I'm paraphrasing, but it's like, it's occupational stress that isn't being effectively managed. Now, I have a couple of problems with that. First of all, we're not talking about occupational stress. This is trauma exposure. As human beings, our physiology is designed to respond beautifully to short bursts of short-term stress, acute stress, right? But that's not what we have here. We have prolonged stress that has become so much over time that it's now trauma exposure, again, much of which is avoidable, right? And And that is what has these physiological consequences where, people are coming to work. I'm sure you're seeing it in home health care as we're seeing it in nursing, right? We have these amazing healers and professionals that do just such important caring work, and they are dragging themselves out of bed, dragging themselves off the couch, coming to work, and they're giving their best, but they know, and we know, that they aren't performing at their usual level, right? But they're showing up and they're doing it. It's called presenteeism. I'm here, I'm doing my best, but I'm not at my best. And so I started getting very curious about that and looking to find out what is going on here, because these are dedicated professionals who are showing up and giving their best, but they're not at their best. And I came across a couple of theories that were game changers. And the first one is Stephen Porges' polyvagal theory, and perhaps you've seen that floating around, and that's hugely important in how to frame this shift from it's not just burnout into how do we take a trauma-informed approach to what is happening, right? So polyvagal theory was hugely informative. And then also there's another theory called by Dr. Robert Naviaux called cell danger response theory. And this really also shed a big light on what's going on in terms of, one of the chief complaints of people who are experiencing, quote, burnout or occupational related trauma is this bone weary exhaustion. Like, it's my day off. I want to go to my kid's soccer game, and I want to garden, and I want to, go to the family picnic this afternoon. And, and we want to live rich, full, and meaningful lives. And Saturday morning comes, and I can't do any of it. I'm exhausted beyond exhaustion. And so I started looking at this phenomenon, because people are also dragging themselves to work feeling like this.
Right.
What it comes down to is there's in our cells, each cell of our body, there's a little organelle called the mitochondria, and it produces all the energy for everything that we do. And so what happens, the spoiler alert is that through this sustained trauma exposure that has not been addressed, that has not been facilitated and healed, right? What that does is it creates stress on the mitochondria, and then the mitochondria get rigid, and so they can't produce the energy that is needed. And then if it still persists, and this is where many people are, then the mitochondria get dysfunctional. And that contributes or underpins a whole myriad of mitochondrial dysfunction related health conditions, chronic health conditions that are often misdiagnosed as, oh, it's anxiety, or, oh, it's burnout.
Real quick, Dr. Lorre, how long does it take for that physiological response to happen? Is this over time, or is this like an instantaneous thing for the mitochondria?
It's an over time thing. And, I don't know that has been studied in the deepest of dives, but what I do know is that we are built as human beings. We are built for saber-toothed tiger attacks. Right. We are built for flight or fight. This is our autonomic nervous system. We are built for short-term stress. And when you get into chronic stress, and then you start looking, well, is it chronic stress or is it trauma exposure? So much of that, you can't just put like a thermometer in it, because the wild card of all of this, and this is why we have to start here, is what is in Lance's personal trauma history that did not get fully healed or integrated, is what it's called, at the time that the trauma occurred. What's in Dr. Lorre's? What's in, fill in the blank? What's in that person? And I call that what's in our repository. So what we know, and this is through the lens of polyvagal theory, Dr. Stephen Porges, what we know is that the body, and also the body keeps score, Vander Kessel, is his book, The Body Keeps Score. But this is actually his work too. What we know is that unintegrated trauma. Okay, so let's say a very bad event happened, and you didn't have the people that you perceived that you needed to help you through that before, during, and after. Now, you may have had people there who loved you and cared for you the best they could, but they didn't understand trauma. They didn't understand how to help that phenomenon move through the body so it doesn't get stuck in there. And so most of us have partially healed from a major traumatic event. And what isn't healed is called unintegrated, right? And that gets stored in the body, and it gets stored primarily in the skin, the muscles, the fascia, why so many people have fascia problems, right? And the neuroplexes.
Mm.
And it stays dormant, if we kind of think of some of the viruses that we know, they kind of hang out in the body, right? They're not active, they stay dormant. And just like this, unintegrated trauma just kind of hangs out in the body. But then when there's something in the external environment, which could be our work, right? The trauma exposure at work, something in our external environment, or there's sort of a trigger on our internal, right? That kind of reactivates that trauma that is stored within each of us. And so that's what starts. So now what we have is sort of this trauma snowball effect, if you will. So we have a healthcare professional and a patient or a home health resident, right, who's had their own trauma, and they're going through a health scare, for lack of a better word, from the person who's experiencing it. Can be very scary. I worked with a lot of stroke survivors, and so that is something that is very, very disruptive and hard to manage, just as one example. And so we have patients who are experiencing this, and then we have healthcare providers. And so we have trauma meets trauma meets trauma, but we're not calling it that, and we're not taking an approach. So for me to tell you, Lance, you know what, you need to do better self-care. If this is happening to you, go do better self-care and go work on your resilience.
Right.
And unless we're getting to the kind of the root cause, we have to go to the foundation. So I think of it as a foundation, and that's how I framed it in my book. So if you're going to build a house on anything, you want to have a lot of rebar and a lot of concrete and a strong foundation, right? Absolutely. And so that foundation for us is our autonomic nervous system and our vagus nerve. That's our most primal stress response system that has kept us alive over the millennia, right? And so we start there, and making sure that we feel safe, are safe, and know how our body is communicating to us through that system. So then we know how to take care of it. And none of this is taught in nursing school. None of this is taught in medical school. I would venture to say it's not taught in home health curriculum, although I'm not sure, because it's all pretty relatively new science, so it hasn't worked its way into universities and other, college type programs or trade schools, et cetera. It hasn't made its way through, again, that takes time. And so we start with the autonomic nervous system. And then, so I have like the framework that I developed. It's called 3 A's plus a B leads to 3 R's. So 3 A's, a B, and then you get the 3 R's, and you want the 3 R's. That's where we're going, are the 3 R's. And so we start, the 3 A's is the foundation of our house. This is where we're going to get that rebar and that concrete, and we're going to get very clear about how strong our foundation is in terms of our autonomic nervous system and our vagus nerve. So the first A is awareness, and we are doing the first A in this podcast together. Like we're bringing awareness to this. Yeah. And the second piece of that is becoming internally aware of how your body is like, oh, I didn't even know my autonomic nervous system did this, let alone under these conditions, it behaves this way or responds this way, and other different conditions, it responds a completely different way. And understanding, becoming aware of how all of that works in a very user-friendly sort of way. It's one chapter in my book that just kind of, we walk through it all together. So the first A is becoming aware. The second A is attending to our autonomic nervous system, or I just say nervous system. So attending to our nervous system, nurturing and nourishing it, because that's our most primal system, and it innervates nearly every cell in our body, every body system for sure. Innervates every body system. So why wouldn't we want to take care of the master control? And make sure that everything is healthy and thriving there. And that's part of what I bring forth in my teaching, in my book, not only in my book, but I have a Haelan Academy where to have a 12-week program through my nonprofit where people come in and we actually go through a 12-week program to kind of unwind what has happened in the nervous system and kind of use neuroplasticity to retrain the nervous system so that that's what we found out is that, it's not even burnout really. It's so much more. So that's the second A. The first A again is becoming aware of the situation in the global and being aware of how it works in your unique body. The second A is attending. And so I have, I think it's right around 100 practices, most of which can be done in 30 seconds or less. So this is something that is intended to be able to implement it on the job.
Okay.
Not deferring till the weekend, because your mitochondria and your nervous system, they need you now, right? Like they need you while you're working. And so implementable 30-second practices that you can implement. And then the third A is what I call alignment. And this is probably the most subtle of them. And it's really looking at the relationship between what is happening in your inner world being how is my vagus nerve signaling? How is my autonomic nervous signaling? And how is that affecting my emotions and my behavior right now?
Right.
Right. And then looking and aligning that to what's happening in your external world circumstances. So sometimes there's stimulus in our external world, stress, a trauma trigger, which I don't like that word. I call it an exposure, but everybody knows what a trauma trigger is. So we'll go with that word one time. But something on the external might be activating something on the inside. Or conversely, so something on the inside got touched, and you're having, it might be in my case, when I was going through my own healing process, because I have recovered from severe PTSD with limbic system impairment. So the degree to which I have lived this in my personal life has been substantial. And one of the behaviors that I was not aware of until I started my own recovery was that in response to stress, I was a door and cupboard slammer and a muttering under my breath person, external rah, 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 rah. And that is really inconsistent with my personality. I'm kind of a Zen, chill vibe, kind of a person most of the time. And then all of a sudden, out of the blue, I would become kind of this archetype that wasn't really consistent. And so this is when you might see, and that's when, there's something that's going in within me. Nothing had happened on the external that was, an overt cause effect sort of thing. And then it's like, because I'm feeling some kind of way about something that is coming into my inner world. So that third A is a little bit nuanced, and we spend a lot of time in the academy with that, really kind of learning that internal, external, because we are inseparable from our environments. We are inseparable from the systems and contexts in which we live and work. And that's why the World Health Organization of burnout is, it's a little bit gaslighting. Mm-hmm. And it also assumes that I have one nervous system and one body when I go to work, and then I have one nervous system and one different body when I go home. Mm. And we are whole human beings, each of us with a lived history that includes trauma. All right. So we have the 3 A's: awareness, attending, and alignment. And then that's our foundation. All right, now we have a strong foundation. We can withstand a whole lot more stress and strife, whether it's internal generated or external generated.
Mm-hmm.
And then on top of that is the B, which is balance. And I think of it as a bicycle wheel, and it's all the wellness things that we all already know. Sleeping, hydrating, exercising, eating right, having healthy relationships, being a good financial steward so that you are adequately resourced, and living in alignment with your beliefs, your values, your purpose. And that's where most people start. And this is what I discovered in my research, was that the nurses that with whom I was, working, they were doing all of those things. We have a license that says we know how to help everybody else do those things, right?
Right.
And so it was so counterintuitive to me. Like, why are these nurses showing up and doing all of the right things in this balance domain and not and getting worse or not progressing? And then when we started looking at that foundation, we started looking at the 3 A's, and we started really taking a polyvagal, trauma-informed approach, and we started working on that foundation. And then putting the balance, all of the traditional self-caring things on top of that. Then we got to the 3 R's, which is where everybody wants to be.
Mm-hmm.
And the first of those R's is regulation. We need to be regulated in our nervous systems. And why is that? Because that is when we are regulated in our nervous system, it's called ventral vagal tone. It means that we are calm, we are grounded, we are centered, we are present, we can see the big picture, we can relate to one another in a heartfelt, very authentic manner. And we have enough sympathetic online that if a saber-toothed tiger comes in, or if we have a stressor, because life is lack of those, right? When those stressors come in, we have all the bandwidth that we need to manage the stress, and then we return back to the ventral vagal tone, or our window of tolerance is another way. So being in nervous system regulation, I'm kind of using different terms to all say the same thing, because I know everybody's read different things online, and all of them have merit. And so we want to be regulated in our nervous system. That's the first R. And then the second R is really important. We want to be reconnected. So many of us who are experiencing unintegrated trauma, which I would say is the vast majority of people, and we just don't understand that that's what it is, and we think it's anxiety, or we think it's depression, or we think it's chronic fatigue, or we think it's IBS. By the way, each of those I was misdiagnosed with while we were trying to sort this out. Now, I'm not saying that those conditions aren't accurate, but I'm saying we need to start looking at the underlying trauma and work there, and then see if we have the diagnosis, instead of just writing a script and saying, go take an SSRI, and good luck with that. And so what happens is when we're going through this, we have a sense of inner disconnectedness, because we know who we are. Right. We know that we care. We know that we want to have rich and full and meaningful lives, and we want to take really good care of the people that we are tasked to care for, or in our leadership or administrative roles, right? We all care about what we do, and it's like our give a crap gets compromised because of all of this.
Well, and do you think, Dr. Lorre, do you think it's also difficult because, we're talking about nurses, they're professionals, they're, like you've mentioned, they're expected to be the healers and not the patient, that mindset. Do you think it's harder for them to accept it, or to even kind of share that they might be going through this because they fear maybe how they might be viewed, or they're less competent or able as a nurse? Do you think any of that plays a role in this?
Well, I think there's a couple of factors at play. First of all, I'm meeting with major hospital leaders in the U.S. right now, and also in Canada. And they are looking, hospitals are looking for solutions. They see that nurses are not doing well. They see the turnover rate, which costs them a lot of money, right? It's, as with any business, it's so much better to take care of your employees than it is to have kind of this revolving door.
Right.
And so they're looking for solutions. But this science, I mean, I and Dr. Karen Foley are the only two people on the planet right now who are really, like, this is very early in the science game. So there is not yet the language in place. There is not yet the system. There's a whole education piece. And that's kind of what I'm doing in terms of working with the hospital leadership, is like, let us start training the nurses on reframing this burnout thing. Because what we know is that the nurses are feeling gaslighted. It's like, I'm showing up every day, and perhaps the same could be, I mean, I was a CNA. I know how hard direct home care is, and healthcare, and all of that. So we are all, nurses and otherwise, showing up and doing our best. And we're being told to, it's burnout and it's resilience, and, you need to do better self-care. And it doesn't matter if you're sitting on top of the highest Himalayan mountain, for a month doing self-care, if we're not getting to a state of nervous system regulation and knowing how to navigate, learning the language of the nervous system and how to navigate it. So that's what the road ahead. And to answer directly your question about, is there a stigma? Is there a mental health? There has been a lot of, we do have a lot of data about that. And it has gotten better. I mean, I've been around since the 1970s, and it has gotten better. But there is still, and I'm loosely quoting the statistic, is somewhere around 35 to 40% of nurses, even if there are employee assistance programs that are paid for by the employer, they're not going. And so the nurse leaders, the hospital leaders that I am speaking with, they're like, we built them a gym. We built them a wellness center. We added benefits. How come they're not using them? And I'm like, well, it's the same, let's take a trauma-informed approach to this. It's what you're asking, essentially, is you're saying, if nurses were firefighters and they're getting traumatized at work, right? Avoidable nurse-specific traumatization, right? A lot of, you're asking them to go into a burning building and meditate. It's the equivalent. Asking a person to come to the place where the trauma exposure is happening and to be vulnerable and open to heal in these ways isn't available. And that's why they're not coming to the gym. And that's not why they're not coming to the lavender lounge, right? It's because we have a deeper issue. It's not, see, that comes back to that B piece. That's the balance piece. Right. But we haven't done anything about those 3 A's, right? And so that's the road ahead. And I don't want to leave the listeners hanging. I just want to finish that third R too.
Yeah, please do.
So we'll just go through it really quick. So the 3 A's are awareness, attending, and alignment. The B is balance, which is all the wellness and self-care things we all know. And then we have the R's of regulation, reconnection within ourselves, which then means now, because we're regulated in our nervous system, we're in ventral vagal tone. That means now our social engagement circuit is online and we can reconnect with our families, with our loved ones, with those in our care, with our colleagues, right? And then the last R is restoring our healer's heart, because through all of this, our why for what matters most, whether that's personally or professionally, I call that our healer's heart, like in our deepest layers, in our deepest truths and vulnerabilities and wishes and hopes and dreams and desires and all of that, like super deep layer stuff, is what I call the healer's heart. And that gets sort of, the nurses that I've worked with said, it's like, oh, my healer's heart, when I asked them about it, it got steamrolled. It got put through the paper shredder. It got put through the meat grinder. These are the types of language that are used around, around our why for our profession and everything else. So we have work to do. And, you and I are doing our part to, be advocates and way showing lights for people who that we work with, our colleagues, and making sure that we're giving them the information that they need and some of the tools that they need, really, to reframe what they're experiencing. Because a lot of people feel like there's something wrong with me, like
Right.
I have some sort of a deficit. And I'm here to tell you, no, you do not. This is your physiology telling you your body is always striving for homeostasis, for optimal wellness. Always, always, always. That's what the body is always working towards, without exception.
Absolutely.
Even when we have really difficult health challenges or disease processes, the body is still trying, is
Yeah.
still working towards that. And so it's not a you thing. It's not a character flaw. It's not a deficit. It's not a personality attribute. It's a physiological phenomenon that until recently we didn't have the science and the language and the vocabulary and the frameworks to
Mhm.
guide change in place. Well, now we do. Now we do. And so, we can now take a next step towards what I call, occupational safety in a trauma-informed way,
Mhm.
and professional well-being, that will also have ripple effects into every aspect of life.
That's wonderful. I want to kind of stay with some of the symptoms and, the more physiological, signs and the way this presents itself. What are the nurses' burnout symptoms really saying? Is it saying they're suffering from occupational trauma or personal trauma? They need a break. What does it really say when they're presenting with these symptoms?
Well, and this is like a kind of a perfect question because we can't we have to look at it not from, so we all want to look at it from kind of what I call our upstairs brain, right? This very analytical, rational, executive decision making ability to, as though burnout and nurse specific trauma are different, and what do we need to do at work, and making kind of all of these divisions about this symptom means that, and is it this and is it that, and that all has merit. I'm not discounting that. That's how we get stuff done. But what we need to understand is that we look at it through a physiological lens. Let's look at the whole person. Look at the whole person and what is happening in their cell response, in their autonomic nervous system response. And so sometimes it can look like, some physical symptoms. It can look like exhaustion. It can look like sleep disturbances, appetite disturbances, GI disturbances. It can look like anxiety. It can look like depression. It can look like irritable bowel syndrome. It can look like insomnia. It can look like a lot of things that when we go into a healthcare setting and we are getting support, like I'm having, I can't sleep and I'm anxious and I'm lashing out and I'm slamming cupboard doors and I'm uttering things that ordinarily would never come out of my mouth. And what is happening here? Okay, we'll use myself as a case study, right? I don't have to worry about HIPAA that way. And then it's like, well, you probably have anxiety and stress and so here's some peppermint oil, true story, and not to be disparaging to any health professional, just showing a gap in the science and a gap in how in our clinical practice guidelines, right? And so here's some peppermint oil for you to try for your IBS. Well, there's really nothing we can do about that. And then here's a couple of prescriptions for what we might think might be anxiety and depression, and go try that. All right, so now I've just done a whole bunch of stuff that isn't getting at root cause, right? We didn't solve anything. Maybe, and in my case, it didn't even alleviate the symptoms because I didn't need the medications, right? Right. And so it's really getting to understand, like, let's look at the whole person through this lens of polyvagal theory. So let me ask you this question, Lance, when you've ever gone to a health provider, right, to a medical appointment for any particular reason,
Sure.
how many of them asked you about your trauma history?
Not a single one.
Hmm. And how many of them examined, how the impact of the trauma that is stored in your body, which we know that is factual, that each of us has within us old trauma that is stored, and it gets liberated under when conditions are favorable for healing,
Yeah.
but not always in a timely or convenient time, as I will attest, and not always comfortable.
Right.
But always in service to our greater growth and resilience, right? But how many health professionals are asking about this? I myself, with a severe trauma history, which we don't need to unpack, but to the point where it created an injury in my brain, in my midbrain, right? That is the degree to which I have walked this walk in my personal life.
Yeah.
And so when I was doing my graduate studies in nursing, I was like, well, let me look at this ACEs, this Adverse Childhood Event Questionnaire, this, and that if there's a screening that's done, which you and I, no one even asked, and I'm sure many of your listeners and all of my nurses that I've worked with, thousands, no one, we don't, and so you look at even the instrument that we do have, and it didn't capture the trauma experiences that I had, right? And many of us had that weren't on the top 7 of this particular list that was developed decades ago. And so even if they're asking, right, let's just give benefit of the doubt, even if a healthcare provider is asking and they're using that tool, there's probably millions of people just like me whose trauma history doesn't fit that rubric.
Right.
Right. And so I think what's ahead of all of us is understanding how unintegrated trauma works, for which there are no assessment tools. Understanding that each of us has trauma stored in our body in some fashion that may be underpinning some of our chronic conditions or our professional well-being or our quality of life in other dimensions, right? And really, starting at that foundation. Like we thought the foundation was the B for balance. We thought it was the self-care piece.
Yeah.
I mean, you look on any website anywhere, it's like, start here, start with self-care. But what we didn't know was there was a whole basement. There was a whole basement where the 3A lives, the 3As are, and that foundation has been ignored. And well, not ignored, because you can't ignore something that you don't know is there.
Yeah.
Right. And that's how science works. That's what people like myself in these roles, that's our job, is to go figure out, why isn't this A plus B isn't working? Why is it not working? And then we do some discovery and we find out, oh, because there's a whole 3As under here. That's why.
Yeah. When you look at, the book, Dr. Lorre, when you first started it, what I'm asking is, when you do research or you have a hypothesis and different things, how did your views and opinions change throughout the course of writing the book and your research? Like, what did you originally think versus what you discovered?
Well, I wasn't even writing a book for nurses in the first place. So it's so interesting. It's such a fascinating question. I was writing what they call, which I have learned, because we don't get taught how to write a book, in I had to go to a writing school, I got to. I went to a program to learn how to write to a general professional audience and meet them in their living rooms. I'm trained to write in scientific peer-reviewed journals, which nobody wants to read that in their living room, right? And so I had to kind of, learn how to write in these ways. And so when I was in that process, I for 10 years I worked in the College of Social and Behavioral Sciences. Right, so I'm a multidisciplinarian kind of scholar. Like I travel about the disciplines, and so I taught a course on human suffering.
Okay.
And to my utter surprise, I had undergraduate students who were lining up with a wait list to take my course that was offered at 8 a.m. No undergraduate ever wants to be any place until noon. And yet they're lining out the door to listen to this old lady talk about human suffering.
Yeah.
And so I thought that I was writing a book about human suffering. And so that was what they call the book before the book. Right. So I did a lot of my research and whatnot. And it occurred to me that as fascinating as I am, because this is, and there are people like me who really want to get into the underbelly of the human condition and kind of into those deeper layers that are a little uncomfortable and not always, rainbows and unicorns.
Right.
And so it occurred to me that nobody was going to read the book. I mean, I wrote it and it's good. And I mean, it's good first draft good. It's not finished draft good. And so I really sat with that and was like, who exactly, who am I trying to help? For whom can I make a difference in a tangible, meaningful way as I am being called to do in my dharma, in my life purpose as I understand it now? Who am I trying to help? And I sat with that question for several weeks, like who specifically? And then it was like, hello, the nurse, you're a nurse scholar.
Mm-hmm.
Why aren't you writing a book for the nurses? and so that's when I kind of made the pivot and then really started taking all the research from that first book before the book, as they call it. And then I started, and at that time, then the science was coming out around polyvagal theory, and the science was coming out around cell danger response theory. And then it was like, and then the middle range theory of nurse psychological trauma came out, all at the same time that I'm writing this book. And so it was this really synergistic process that, I'm a woman of deep faith. And so I feel as though this work was also divinely guided. Like, I think I was writing the book before the book because I was supposed to be in some small way. I was supposed to be part of this new paradigm that is unfolding around the burnout problem.
Well, there's a famous Bible verse that says, "Physician, heal thyself." And that's what it makes me think of when you just said that.
Yeah.
As we close up, we're going to have all the information in our show notes, links to the book. Why don't you share your website right now for the viewers and listeners, and we'll have it up on the screen as well.
Oh, that's so kind. I'm so grateful for that. There's a myriad of services and resources for everyone there, including resources for the end of each book chapter in a nice PDF form so that you can download and do your activities. So everything is there for you. And I'm going to spell it because my first name is spelled a little strange. My mom got really creative on that one. So my website is drlorrelaws.com, and that's DRLORRELAWS.com. And there's literally anything you could want and more. And you can reach out to me just on the contact form. I and my team, it's a nonprofit organization, so we're standing by. We are here in light and in service to anyone that we can make a difference in your life, no matter how big or small.
That's wonderful. And, before we close, how does nursing our healer's heart offer hope, healing, and a pathway for nurse trauma and the burnout recovery? Like talking, to our viewers and our listeners, or, even people that might be reading about this down the road on the internet, how does nursing our healer's heart offer that hope and healing and a pathway for these nurses that have dealt with trauma and they're going through the recovery process from burnout?
Yeah. Well, it's really for anyone who's experienced trauma. The introduction and the last chapter are nurse specific. Everything else is like anybody, which is all of us. So anybody with whom this resonates, that works for you. And the hope and framework is really a couple of things. It's many of the things that we've talked about is taking a deeper dive into the most current science and understanding that we have the 3 A's that are lurking about unattended. And that's why when we put the self-care on top of them and we're not getting better, that gives us a place to look. And also because there's an actionable framework. So the 3 A's, the B, and the 3 R's. Okay, it's an actionable framework that people can implement immediately, right? And then there's 100 practices to help you understand, and some assessment tools to understand where you are in your nervous system at any given time, and then what practices, what strategies, what tools can you put in your toolkit, as I had to with my own toolkit of, if I'm slamming cupboards and muttering things I normally don't mutter, then I need to get this part of my toolkit out, and I need to get tools A, B, and C, and so that I can return back to my nervous system regulation. And so it offers not only the science, but actionable steps and practices, and a couple of which, many of which can be done in under 30 seconds, so that they can be integrated into a nurse's or healthcare professional's daily practice, like while you're walking to the med cart, or while you're sitting down to chart at the computer in 30 seconds. You don't have to take extra time out of your day. It was really important that we have something that was, I call it, where you can mind the gaps in your day. We all have little gaps in our day. We're going to get our cup of tea, or we're getting ready to answer an email, and there's 15 to 30 seconds right there that if we are mindful and we know what to do, that we can make sure that we stay regulated in our window of tolerance. And so that's really the pathway out, is building that toolkit that can be used at work, at home, at anywhere, and you don't have to spend $1 bazillion, and you don't have to take a whole bunch of time off of work. This is something that you can actually integrate into your life, into your personal and professional life seamlessly with minimal effort. There is a learning curve, of course, as with all things.
Yeah, no, that's wonderful. And just a parting question here I like to ask our guests, and you and I will keep in touch. I just so respect and admire the work that you're doing, and what you represent, Dr. Lorre. Thank you for your time today with us. But if we didn't talk and we ran into each other at a conference or anywhere 5 years down the road, where are you at that point?
Well, 5 years down the road, I am facilitating healing for all health professionals and anyone who has been affected by trauma through my nonprofit. I am retired from the university, although I love my professional role, my healer's heart, my calling, my why for what matters most at this point in my life is I'm sort of at the apex of my career, where I'm actually thinking like I'm actually a grandmother and thinking about retirement. I don't even know how those things happen, but yet here we are. So my plan is to pivot and to be doing this as a philanthropic effort for my post-retirement years, and really be in service in the way that I feel is very divinely guided and supported.
That's wonderful. Well, Dr. Lorre Laws, thank you so very much for what you're doing. You have a wonderful mission, and we're just the healthcare and society as a whole is fortunate that this is your calling, because family caregivers, they experience burnout. CNAs experience burnout, police officers, just your person at your grocery store, and it's something you have to protect your healer's heart, like you said, because burnout can be very significant if it's not addressed and taken care of. So thank you again so much for your time today.
Thank you for having me. It was just a great pleasure, and maybe we'll do this again next year.
Absolutely. Absolutely. Yeah, absolutely. Thank you, Dr. Lorre.
Thank you.
Thank you for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms, or watch the show on our official YouTube channel. Just make sure that you hit that subscribe button so that you never miss an episode. I'd also like to say thank you again to Dr. Lorre Laws, the author of Nursing Our Healer's Heart, for joining us today here at All Home Care Matters. We look forward to seeing you next time here at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.